Good day, everyone. I'm David, moderator for this webinar, and I welcome everyone for today's webinar, which is the CMS Hospital Infection Prevention, Control and Antibiotic Stewardship Program, CMS Compliance Requirements for 2023. I would now like to introduce our presenter for today, Laura Dixon. Laura Dixon, BSJDRN, CPHRN, was COPICS, Director of Facility Patient Safety and Risk Management and Operation from 2014 to 2020. In her role, Ms. Dixon provided patient safety and risk management consulting and training to facilities, practitioners, and staff in multiple states. Ms. Dixon has over 20 years of clinical experience in acute care facilities, including criteria care, coronary care, perioperative services, and pain management. Before joining COPIC, she was the Director of Western Region Patient Safety and Risk Management for the Doctors Company, Napa, California. Laura holds a Bachelor of Science degree from Regis University, RECEP of Denver, a Doctor of Jurisprudence degree from Drake University College of Law, Dan Mones, Iowa, and a registered nurse diploma from St. Luke's School Professional Nursing. Cedar Rapids, Iowa. She is licensed to practice law in Colorado and California. I would now like to hand over the floor to the speaker. Over to you, Laura.
Okay, thank you very much and welcome everyone. As David mentioned, what we're talking about today is infection prevention and control and antibiotic stewardship program. There have been some really recent changes and some new ones that are also coming up. I do want to just give a brief introduction. This information that I'm providing is informational. It is not to be legal advice nor to establish an attorney-client relationship. Please talk to your own counsel or legal representation as far as issues that might apply to your particular facility. So why are we here today? Well, anybody who's gone through a joint or commission or CMS survey, no, you don't want to get one of these. That's where they have found deficiencies in meeting the conditions, the elements of performance, etc. And of course, once that does happen, you'd have to do that statement of correction. And then, of course, nobody ever wants to have that notice posted publicly where you are taken off the Medicare and Medicaid agreement. The manual that we're going to be addressing today first came out in 1986. It has had multiple updates since then. So how do we keep up with the changes? Deficiencies. I mentioned that we don't ever want to get that list of deficiencies. So here happen to be the most recent deficiencies for the topic we're addressing today. But let's hit the meat of the program, and that's our infection prevention. But what your program has to show is you're sticking with national guidelines on infection control. The guidelines, these are pretty much some new ones. You have to have an active infection control program. Overall, your programs have to be based on your own hospital's assessment. The surveyor is going to make sure you have to have policy and procedures, CMS. As far as development of your policy, so the antibiotic stewardship program, this is one that really has a lot of special challenges for our facilities. You have to have policies for your antibiotic stewardship. Your ASP program also has to show coordination amongst components of the hospital. We're trying to improve our antibiotic prescribing. The policies on an antibiotic stewardship program, as far as QAPI leadership, I'm going to talk briefly about a unified integrated program. Not everybody has these. CMS did mention them in case they are there. So as far as a unified integrated program, so that's a very brief overview of a unified program. I want to switch to Joint Commission, and particularly those who have deemed status. I'm going to switch over now to CDC, talking about their antibiotic stewardship programs and core elements. Well, let's talk about just briefly some memos on infection control. Joint Commission has it as a standard that you have a water management program to address it. Other issues that address CMS, ISMP, Institute for Safe Medication Practices. They talk about IV push medications. CDC gave us vaccines. Now, I've included all this because it all has to do with infection prevention. And then other infection control, I want to talk about some updates on cleaning procedures. With what's left, I am going through the infection control worksheet. The leader of your program, timeout and monitoring of antibiotic use. Multi-dose files, are they dated when opened? Surgical procedures, proper cleaning between cases, whether it's the anesthesia machine or the terminal cleaning. And then this brings us to my final discussion. Again, I know I went through that pretty quickly, but the tool will really speak for itself, and it's a great self-assessment gap analysis tool. CMS is really they really focused on infection prevention and control with COVID and then some of the other recent outbreaks that have been going on. And as far as, by the way, staff staff vaccinations for COVID, they did rescind the order requiring staff vaccinations for COVID. That did come out earlier this year that they said, nah, we're not going to require that anymore. So with that, thank you, David. Thank you for your assistance, and thank you for everyone who listened into today's program.
Thank you, Laura. That does conclude the session for today. And thank you, everyone, for participating. You may all disconnect now and have a great day ahead.